Hello, our dear viewers and listeners. I greet you in the mighty name of Jesus Christ. I'm here at Abundant Life Faith Center where we've held our annual Hope Health Camp. We hold it every year in the month of October and we run it in partnership with SAS Clinic and Run Dental. Let me first introduce myself. I am Stella Katerega, the interviewer, and a member of Women of Faith, who are the main hosts of this Hope Health Camp. And as I mentioned earlier, we don't do it as a church. We do it in partnership with SAS Clinic and Run Dental. And here we have a very wonderful lady, a medical doctor, who is going to introduce herself.
Hello, everyone. My name is Agnes Chisache. I'm a medical doctor and I work with SAS Clinic. It's been a great honor and pleasure to join you on this Hope Health Camp. Thank you so much for having me.
Thank you, Ms. Chisache. Now I'm going to ask you about the general health questions and give us tips on our general health. Our first question is, what are some of the simple ways to improve one's overall health?
Okay, that's a very great question because I realize that most of our patients are actually sick because they don't really know how to take care of themselves. And so they live every day normally, not knowing that there are certain things they can do to be better. And one of those things that look like they are really small is exercising. Yes, and when people hear exercise, they think it's the gym. Mm-mm. No, there are different ways one can exercise depending on your body, your weight, your gender, and your age. And I usually advise patients that are a bit elderly to just walk. Every day, hit 10,000 steps. That can be maybe 30 minutes in the morning, 30 minutes during the evening, and also just making sure you don't spend your whole day seated somewhere and napping. Yes. The other thing that they can do is really eating healthy. Now, because of the current urbanization, we have more people eating fast foods, the chips, the sausages, the chicken, and alcohol, sodas, carbonated drinks, and all these things are really available. So they are really easy to consume, but they are not good for us. They have processed sugars, which increase unhealthy fats. And then these fats cause other things. Yes. So one way to maintain a good health is to, first of all, improve your diet. That means you should incorporate fruits and vegetables, drink enough water. Please reduce the sodas, the alcohol, smoking. Yeah, and the other thing I can think of is really screening. Yes, I acknowledge that health is expensive, but at least teach yourself to run general body checkups every once in a while so that diseases are, if you're ill, it can be curbed earlier and therefore treated much earlier to prevent more complications. Yeah.
Thank you so much, Ms. Chisache. You've mentioned about exercises. Now, there is a general feeling in the public that exercises are for the elderly, or those who are sick, or those who have got chronic diseases. But we believe at a certain age, everyone is supposed to do some exercises. Let it be between 1 and 10 years, 10 and 20 years, 30 and 40, and the 50s. Can you advise that on the best range of exercises one can do in the various age groups I've mentioned?
First of all, when you're elderly, you can't run. Like, even if you would really want to, your bones may not be strong enough for you. Let's say about 50 years and above. Or really depending on your medical condition. Some people have bone issues, so they can't run, they can. Yeah, but if you're fit enough, let's say the teens really, and 40s, those guys can run. In the morning, run. In the evening, take a run. You walk, if you can walk, and actually it doesn't have to be so complicated. I know most adults are working, and so they're like, I don't have time to do all those things. But it seems if you're going to your workplace and it's about 30 minutes away, you can choose to walk 15 minutes of that journey and then board 15 minutes of the remaining journey. Just find a way of adding this into your daily routine, whether it's walking to your workplace or walking back home. Yes, whether it's just walking around, for those that are stay homes, they don't work, walk around your home, take evening walks. Yeah.
Thank you so much, Ms. Chisache. Now, exercise is also known as one way of reducing stress and anxiety. Can you tell us any other way we can reduce stress and anxiety?
Well, interestingly, stress and anxiety are really more of mental issues. And anything that has to do with the brain, it's not a one-way thing. That means you have to involve a number of things to help you. And you'll be surprised that actually praying and reading the Bible does help with stress and anxiety. But the other thing is to sleep. Sleep is a good stress reliever. If you can, that's why most people that are actually stressed, when you really go deep and speak to them, they don't sleep enough. Maybe they have trouble falling asleep, they have trouble sustaining sleep. And this all shows us that to manage your stress, your anxiety, you must sleep enough. But also, we know that work stresses people, children stress people. And so someone just have to develop good stress techniques, management techniques, really. Yes, and this, as much as the doctor can help you, it also calls you to take charge of your life. Yes.
Thank you, Ms. Chisache. Research has it that persons who go to church and those who read the Bible frequently live longer. So, and the Bibles are there, the word is there, the churches are near us, and it's free of charge. So why shouldn't we embrace reading the Bible and going to church, or going to the mosque, or have a holy, a unique time with yourself? So thank you for that highlight, Ms. Chisache. Now, earlier you mentioned about screenings. What is screening?
All right. Screening in simple terms is, I would say, is wanting to find out about something. You may not necessarily be sick, for example, but I can just say, let me go today and take my blood pressure. You're screening for hypertension. So screening you for something basically means they are testing, so whether it's there or not, whether you're sick or not. Yes, in simple terms, really. And like you said, screening is different for different ages, but not just ages actually, also different experiences, I would say, and backgrounds. If let's say, let me give an example of a 30-year-old, a female, from a family where the mom has hypertension, has diabetes, father has hypertension, and maybe one of your siblings has diabetes. For a person like that, I would say they are high risk. And therefore, I would advise them to be more intentional, to screen for less hypertension and diabetes. Let's say every 3 months, you pass by a clinic, they take your blood pressure. And if it's okay, it's normal, that's when you can take that time. But if they find it at a certain, there are those figures, digits, that when we see, we tell you be more vigilant. And so when you get there, then it becomes more frequent. Let's say twice a week. Yes. But also, if someone is overweight, has a high BMI, what is BMI? BMI, literally, they take your weight and your height, and they help you calculate that like a ratio. And if it's above a certain number, they tell you now you're overweight, now you're obese, or you might even be underweight. And depending on where you lie, you're guided. And high BMIs are associated with certain things like hypertension, diabetes. So someone with a high BMI would also be, it would be good for them to screen more often. And the other thing, let's say a child now, a child below say 10 years, if they are sickly, or if they are the mother has, let's say, sickle cell, the dad, and you're not sure, it's good to screen your children for sickle cell disease. If you're hypertensive, it comes with different complications like kidney disease, heart disease. So it'd be good to also screen. Usually, if depending on whether your pressure is controlled or not, you might need to do those say twice a year. Yes, just to get to know. And then for males, at a certain age, there's what we call a prostate gland. At a certain age, about 45, it tends to increase. Now, that's normal. Yes, it happens in all men. But if it increases at a certain point where it's giving you symptoms, that's where it becomes now harmful. And so when you're above 45, 60-ish, it's good to also check for that. And if you're found that it's enlarged, then you go ahead and screen and make sure it's not cancerous. Just healthy living. We are not saying you're sick, but just come in, have a chat with your doctor, and know how you're doing. Then for the women, if you're sexually active, then it is good to screen for cervical cancer. It also depends. If you're immune compromised, let's say you have HIV, or you're on immune suppressing drugs, then you might do it more frequently. But if not, now like me, if I decide to screen, I might take like 3 years before another screen is done. So yeah, the dynamics are there, but your doctor guides you on what to do.
So thank you, Ms. Chisache, what you have mentioned about screening. But let me say that in a layman's language, screening is testing to find out whether your body health is okay. So whether you feel you are okay, go for screening. And when you feel you're uncomfortable, your body is uncomfortable, any part of your body, you're not feeling well, go for screening. Thank you so much for that insight. Now, you mentioned about lack of sleep, and it's becoming a general problem, especially for people who are in the corporate world. They complain, I don't have sleep. Yet sleep should come naturally, like a baby, put him or her on bed. That's what is expected for each one of us. But what causes lack of sleep?
Thank you for that question. Lack of sleep, I would say there are different causes, but one of those is stress and anxiety, which we've talked about. And the stressors are many, and the stressors will always be many. Because as long as you're here, you're either working, or you're married, or you have children, or you're in ministry, or you're in business, there's always something triggering that stress and anxiety. And that's why I said it's good for someone to know how to manage it better. But the other important cause are our electronic gadgets, friends. You go to bed with your phone. Yeah, and how that affects you really is because, let's say you went to bed at 10, but you've spent a whole hour scrolling through TikTok. Yeah. It all affects your brain a certain way. And you find that you can't fall asleep. You might maintain, because also lack of sleep is really different. Some people fall asleep easily, but when something wakes them up, they cannot sleep again, or they cannot maintain sleep. So they sleep, and then at 1 they're up. Yes, the electronic gadgets that we carry to our beds, they are not very healthy. And also having actually we call it poor sleep hygiene. You're taking your phone to your bed. You don't have a regular sleep pattern. Yes, thank you. You don't have a regular sleep pattern. Today you go at 9, then the next day at 10. Then today you wake up at 5, the next day at 6. Somehow also your brain can't regulate it very well. But also importantly is what we eat. Things like coffee, and now caffeine is in many drinks, really, in coffee, but as well in sodas, the carbonated drinks we drink. Caffeine does affect our sleep, yes, and alcohol, yes. So it's important to reduce those. Or if you can stop, not like the alcohol, really, you stop. But yeah, those are some of the things that do affect sleep. Mm.
Okay, if before I sleep, if I sleep at 10,
Mm.
what time should I stop being on phone?
If I want to sleep at 10, okay, the best thing would be don't carry your phone to your bed. Once you say, okay, now I'm going to bed, leave the phone somewhere and go and sleep because you've gone to sleep. Yes, go and sleep. This thing of today it's 9, tomorrow it's 10, you can sort of have a regular time, because actually what that means is, let's say I wake up at 5 because of work. That means on a day I sleep at midnight, I've slept for what, like 5 hours? That means the day I sleep earlier, I've had a longer sleep period. So that means go to bed early so that even when you wake up at your usual time, you've had enough sleep, your brain has rested, and you've been restored. Yeah.
Thank you, Miss Tisache. Now I'm going to ask you about back pain. What causes back pain?
Okay, so the causes of back pain are really many. I can't even finish
Can
them.
give us a few.
But
that
yeah, I'll talk about a few. Especially in us, the young ones, our bones are still a bit strong. But now, our lifestyle. Say I go to my consultation room and I sit from morning when I clock in at 8 till 6 when I leave work. My only time when I stand up is to go to maybe the washroom or get something to eat. Very unhealthy. So people should learn to, let's say if I've sat 20 minutes, yeah, tell yourself, okay, we've sat enough. Stand up for a few minutes so that you're keeping weight off your back for some time. And some jobs, really, you can't help it. I know someone who has had back pain for almost 3 months. She's a seamstress, so most of her work she's seated. Yes. And getting her to actually get relief was hard because that meant she had to stop working. Or at least go to work and, I don't know, lie instead of sitting. The other thing is, for example, in the elderly, it's your bones now. As you grow older, your bones tend to thin. Not for everyone, but for most people. They tend to thin out, sometimes because of deficiencies. Maybe you don't have enough vitamins, enough calcium, and so you find that your bones are thinning out. They can no longer support the weight or the things you do, heavy lifting and stuff. Yeah. But that is for the elderly. And for some people, really, it could be accidents. Could be muscle spasms. Yes. So the causes are really many.
Thank you, Miss Chisache. So back pain is a sign of so many things in the body. So you have to go to a medical doctor who will advise based on your lifestyle, based on your age, based on what you eat, even your weight, on how to manage the back pain. So tell us about the various ways one can manage back pain. Yes, please.
So, of course, when you go to the doctor and they do some assessments, they'll give you some medications which will help. But treatment is not a one-way thing. Actually, even in practice, we don't just give you medicine. Otherwise, people with diabetes just say, take this medicine. But we give you the medicine and tell you what to eat and how to eat it. It's still the same thing. When you come in, we give you that medicine that you need to relieve the pain. But it's important to change your lifestyle. If it's reducing your sitting hours, if it's losing weight, if it's stopping carrying heavy things, or sitting for too long or bending for too long. Yeah, some people really bend. They wash clothes, they clean the house, they sweep the compound. Yeah, by the time you're done with all that, your back is like, no, I'm done. Yeah, so sometimes, most times actually, besides the medicine, you will need to go ahead and change your lifestyle. And depending on the cause, some people even get corsets, which they like tie around you to support. Yes.
Thank you, Ms. Chisache. Now, we have this common non-communicable disease, and it's becoming so common even in the young children. It's called hypertension. Or in a layman's language, it's called pressure. So what are the signs and symptoms of pressure? How can I know before I go to a doctor that, I might have hypertension? So tell us the simple, most common symptoms and signs that one may use to detect that, I might have pressure before the doctor confirms or allays one's fears.
Okay, so hypertension is one of those silent illnesses. Very silent, that someone might have hypertension for a year without actually knowing they do. And in most cases, by the time you start having symptoms that will push you to go to the doctors, that means it's gotten worse. Most commonly, people will show up with headaches, those headaches that really are not responding to medication, or that are constant. You take tabs, then they stop, then they come back. For some people, they will just have problems with vision. The hypertension has really affected like the blood, those small tiny blood vessels in the. Yes, some people, by the time they show up, they already have signs of kidney disease, like body swelling, your face, your feet. Yes, so the best way to rule out hypertension is by getting tested, because it can be really silent with nothing. Yeah.
So as we mentioned earlier, whether you're feeling fine or not, when you go for testing or screening, hypertension should be one of those tests that should be done.
But a good thing, in all medical centers, a blood pressure is one of the first things they do. Yes, when you come in, even if you've come in to test for malaria, they'll take your blood pressure. Yes, and if it needs to be repeated, they'll repeat it, and also advise you on maybe how to take it at home or how to monitor it over time. Yes, but it's one of the first things that is, so that's a good thing.
So I've gone to a medical doctor who has confirmed I have hypertension. There's this fear of chiwede, pressure. Now tell us, is it reversible? Is hypertension reversible? Can it go?
It really depends. It really depends on what stage they found it. If it's been, yes, if it's been caught early, and you can do the lifestyle modifications. And that's the hardest part, really, because most people are too comfortable. They don't want to have to change their diet and do exercise and stress and lose weight. Otherwise, if those can work for you, as we monitor, for some people, you may not need medications actually, on condition that you continue with the lifestyle changes. Yes. But if it has progressed and it's caught late, then it's best if you take your medications as directed by the doctor. Yes.
Okay, those who are on medication reach a time and they say, I've overtaken medication, I'm even tired. How would you counsel that person who feels they're tired of taking medication?
Tired. So sometimes there are different reasons why someone may get tired of taking maybe it's too much medications. They are on like say 2 drugs. So sometimes what is done is you consider that patient and you see whether there is an alternative drug. It has 2 drugs, 2 in 1, so that you reduce the pill load. Yes, the pill load usually it burdens so many people. You're taking one in the morning, one in the evening. Like, when am I off drugs? But if that can be handled, it's one of the ways. The other really is to have a one-on-one with the patient. Explain to them. Most cases, people will not, if they don't know why they are doing something, you just tell them, "Una pressure, ida, idagala." If you explain to them what this pressure does, no one doesn't want to leave. You explain to them its complications. That if the pressure is not at least here, we might have this problem and this problem and this. But if you do this, we'll get going. And in most cases, they try.
They try.
They really do.
Because everyone wants to live.
Yes.
Life is precious and it comes once in a while.
It is.
And once in your lifetime. Okay. Thank you so much, Miss Chisache. Now we are going to talk about preventive care. And one of those methods for preventive care is vaccination. And we know vaccination is for babies. It's from 0 days, I think, to 2 years or 3 years. Is there a vaccination for adults?
Yes. There
Tell
are
us.
there are many.
Really? Tell us.
Well, besides the usual ones we know for our babies, there is one that follows. In fact, now there's even the malaria vaccine. I hope people are getting that vaccine for their children. But anyway, there is one for children. We call them puberty, the HPV, the vaccine. That one that protects children, females against cervical cancer. Yes, that one is given mainly to puberty, girls in puberty, let's say about 10 years and above. For us adults, we had the COVID-19 vaccine. We had the COVID-19 vaccine, but there are other things. There is hepatitis B, there is yellow fever. Now, most times we wait for these until we are traveling. Then we call someone for a yellow fever book without even the vaccine. Oh, Lord. But no, it's actually for our own health. That at your convenience, go to a hospital. Mainly, I think the government hospitals have them for free. You go there, get vaccinated. Yellow fever, hepatitis B. There's even a vaccine against typhoid. Did you know?
No, I didn't know. Tell us.
There is.
When did it come on the market or in the hospitals?
It's actually been there for quite some time. But yeah, there is pneumococcal vaccine for that. Usually, besides the babies, it's more common for now, like elderly patients that are getting pneumonia more frequently or the severe form. Yeah, we advise them to get the pneumococcal vaccine. And it's like you get one dose for about 3 years and you're good to go. Yes, there is the influenza. Yes, for children, you can get that once a year. It doesn't mean the flu will not come, but it will not be as bad. Yes, and as frequent, yes. So the vaccines are many, even the ones you've not thought about. They are probably there somewhere. And yes, I would advise us to get them. Yes.
So when I go for my testing or screening, can I say, doctor, I want vaccination for HPV, I want vaccination for malaria, or I wait for the doctor to recommend?
Currently, malaria is only for children, only. Some, for example, the pneumococcal for pneumonia, you can really request for it. The influenza, you just take your kid to a clinic, tell them about influenza, they'll give it. Pneumococcal, meningococcal, all those ones, they are available. And you may not wait for your doctor. If you're informed and you know why you're getting it, and yeah, you just walk in and request for it. Yes.
Thank you so much, Ms. Chisache. Now we are going to talk about lifestyle and wellness. So what are some of the healthy ways to incorporate physical activity into my daily routine?
So like I said, the reason why most people end up not doing any exercise is because they think they need a special time for it, which we don't have really. You leave home at 5, you go back at 9, you just want to eat and sleep. But there are healthy ways to live and every day. If you're going to work and you usually get a judge, you walk once in a while. Okay, let's say twice in a week. You walk there or walk back home. Yeah. If you're at your workplace, don't sit for too long. Sit, stand, walk around. Ideally, the goal should be 10,000 steps a day and more for all of us. Yes.
10,000, that's how many kilometers?
Those are very many. I don't know about kilometers.
Like 2 or 3 kilometers or
Maybe.
10?
I'm not sure
You
about
don't know.
kilometers.
Depends on the
no.
length of your step also.
Yeah, that's true. And where you are. So you might just walk around your workplace, your home, to the shop and back, and to church.
Okay.
And if you can do some things while standing, then stand instead of sitting. If you can cook while you're standing, you stand. You don't have to sit to chop onions. Yes. The other healthy way of living is really what we eat. I already talked about that. But also importantly, maybe now dinner.
I want my chagulo.
Yes, you can have your chegulo, but earlier. So 7, provided you go to bed like at 9 or 10, so that you give yourself about 2 to 3. And also the portion, the dinner, the portion can be reduced.
So there is this thing of I have my breakfast early, I have a light lunch, I have to enjoy my meal at home. So yes, my supper at home. So when you say the portions, what do you mean by portions? And should it be like one piece of chicken only, or should it be a balanced diet, or vegetables only? What do you mean by portions?
It's good to have a balanced diet really at any meal. But by portions, I mean if you eat 2 spoonfuls of rice lunch, dinner should be 1 spoonful. Yes, I mean the actual size of your food should be small. Yeah, so that you're not eating to get full. Yes, you're eating more for your brain. Yes, not to get full. Supper has to be light. Yeah, it has to be light and healthy. What do I mean? That means put a fruit in there, vegetable, and
Thank you, Ms. Chisache. Supper we are eating for our brain,
light food.
not for our stomachs.
Don't eat too much.
We are used to have to feel it, like the stomach has stretched quite a bit, and I'm like, cut it.
That can be pushed to lunch.
Yes. Then at night, before you go to sleep,
because you're going to
meal.
sleep, and all this food is not going to do much. Yeah, so you end up even gaining weight. Yes.
So the last question on meals. What is your comment on skipping meals?
Skipping meals is actually not as healthy as people think. Yes. You're better off eating small, frequent meals than not eating at all. Yes, so no.
You don't encourage one
No,
to eat
I
meals,
don't.
to skip meals.
Yeah, unless of course for spiritual reasons. I can't argue with God.
Like fasting, that is
I
allowed.
can't argue with God, but normally, usually, no. Have your meals, but know what to eat when and how much.
So skipping meals is unhealthy. Does it have side effects? Auntie, that's what it's unhealthy. Kale,
They
what
want
are
to
the-
know. They want to know why is it unhealthy. Well, besides the, I would say it's a lot of science behind there, because when you deprive your body of certain nutrients, then it has to go to the stores in the body to make those nutrients. Let's say you've not eaten the whole day, so you don't have glucose. So what your body does, because it's wise, it was built to keep you going. To go now to like your fats or your protein stores, break those down so that now you get the energy. So really, it's not healthy because that whole process that process where these other reservoirs are used to make the glucose are not as healthy as the actual glucose you're eating. Yeah.
What is diabetes?
Diabetes is what we call sukari in local language, and and diabetes can affect both the young and the old. Yes, although it's different. Usually in the young, it's mainly because their bodies are not making enough insulin. Yes. Then in the old, it's because, of course, genetics, your parent had it, their parent had it, so you inherited it. But also importantly, like we've discussed, your lifestyle. Your lifestyle, which is leading to weight, which is leading to all these things, can predispose you to diabetes. But ideally, diabetes is when your body cannot process glucose. Yes, it cannot process the glucose very well, and so it remains high in the blood.
So, what follow up care or testing is needed for diabetes?
Wow. So, for diabetes, first of all, once you've been diagnosed and you're on medication, it means you are literally going to be checking your glucose frequently because of the different side effects of the drugs. Yes, some people, for example, those on insulin are very prone to getting hypoglycemia, which is where your sugar now is very low. It was high, you got the insulin, now it is very, very low, which is dangerous for the brain, for the body generally. So that is one of the follow-up care. In fact, most people with diabetes, we advise that they buy the machine so that they can test at home in the morning, or if they are dizzy and stuff, you check and make sure it's not hypo high. Yes. And then we have tests that help us check whether you've been taking your medication. You
So
can't
patient
lie to
can
the
tell you
doctor.
that I've been taking my medication.
I've been taking my
Then they
medication.
test and
Then
they're
you do
like,
the test and that test is high. Then you're like, it's either okay, they've been taking, but the medicine is not effective, or it's that they have not been taking. Yeah, so that test is good. Then diabetes affects different things like the eyes. And so, yeah, we usually advise them to screen and make sure they don't have any effect for the eyes. And diabetes also causes nerve pain. Yeah, those tingling, burning sensations. But usually when it's been high for so long, uncontrolled. So yes, we really need to be tight with the management of diabetes. And of course, screening you for other illnesses, because some of those things don't move alone. Yeah, when you have sukari, chances are high you'll get hypertension. So it's good to regularly screen and make sure that your body is okay. Even the kidneys, yeah, sukari can also affect diabetes can also affect the kidneys. Yes, so there's a test that we want to do more frequently.
okay, from what I know, diabetes is what? Is not reversible. Once you've gotten diabetes, you'll always have diabetes. Is that true?
Actually, just like hypertension, if it's caught early and someone is willing, actually for most people, when you first test your glucose is high, before you're given drugs, if it's not so high, before you're given drugs, they tell you, okay, can you do your diet like this? Can you exercise can we lose weight like this? Some people it works. Yeah, and they don't use medicine and they just work on their lifestyle and their power. However, once the diagnosis is made and we start medication, then unfortunately you can't stop, because it's the medication that is helping your body. I've met patients that because of the medicine, now they test and their glucose is okay. And like, busawo, those are now onye tukome wano. And now you have to cancel them and tell them, yeah, it's normal because of the drug. Your body is not working alone now. Yes.
Thank you so much, Ms. Chisache. Now, this is the last one. From what you have mentioned from the time we've started, where the doctors diagnose someone and they find that something is missing, something is lacking, or something is in excess, they recommend medication. So, medication, you may get treated within a short time, or you may continue taking medication for some time or for the rest of your life. So, what comes out is that medication may have side effects. So, tell us briefly, what are those side effects of medication, general side effects, not for a specific disease, but general side effects for medication?
The most side effect of most drugs is nausea and vomiting. Nausea, that feeling of you want to vomit, and then the actual vomiting. And for some people, diarrhea and the like. Then some are really more specific to that drug. And those ones, you cannot exhaust them because there are so many medications people are taking. But if you feel unwell while you're taking a side, especially if you just started taking it, say you went to the hospital, you had hypertension, they gave you a drug. Then you've taken it for, let's say, a week or two, and now you feel like your feet are swelling, you're always having headaches. It's good to go back to your doctor and let them know. Yes, so that, because there is always an alternative. Yes, there's always an alternative. And I know patients are, when they experience things like that, their first reaction is to stop. Just stop and don't even go back to the doctors. But really, when you're taking medication and you experience anything, even it's body itching, because some drugs cause body itching, redness, stop the medication, but let your doctor know so that they know how to help you. Yes.
Okay, they'll stop the medication in protest. Then they say, but there is this herbal medicine here. I heard it works for this condition. Would you advise one to go for herbal medication?
No, but that is probably everyone knew. There's no doctor that can tell you go for herbal. But really, the reasoning is this medicine we use has been studied. Before it's brought on market, it's been tried, it's been tested and proved. We know how much you should take, how much is dangerous. Well, whereas for herbal medicine, you don't even know. Even the selling you the medicine doesn't know. Do you take two spoonfuls, or you can take a cup? And we don't know the side effects really. So no, I wouldn't advise anyone to try herbal. Go back to your doctor. They always have a solution. Even if they don't know, they'll refer you to someone who knows. Yes.
Okay, thank you, Ms. Chisache. You've told us so much about our general health, how we should maintain a healthy lifestyle, how we should go for medications to doctors, not to herbalists. Now, you've been here at the Hope Health Camp, and this is your first time here. Tell us a brief on the experience you've had, the patients, the common diseases, and what advice would you give to the public?
All right. So the camp has been good, and I appreciate the fact that there is medicine. Yes, I don't like seeing a patient and then every drug I'm suggesting is not available. But it has been nice. Most of the drugs we needed were there, and patients could access them. And because I mainly saw the elderly, I don't know why. Maybe it was a design, but the most common has been hypertension. And one of the challenges I've noticed is that these patients don't even know the drugs they are taking. So someone has hypertension, but they don't know whether they are taking. All they know is I'm taking some medicine for hypertension. Meanwhile, they didn't carry it, and they didn't carry the papers. So yeah, it's been interesting. But the other common illness I've seen was issues related to bones, back pain. Yes, and really back pain in most cases is from a condition that now causes pain to travel down, yes, to like the knees. Yes, so I've seen that a lot as well.
So I believe you've recommended them to see specialists for the conditions you found them with. Mm.
We've encouraged them to first of all take the medicine, and secondly to seek medical care, because many of them had hypertension, like let's say a year. Then they took drugs for like 2 months, then they stopped. So I'm like, okay, although I'm giving you drugs for a month, please make a follow up visit. See your doctor. Let them look at you. See how much of the medicine to continue, what to stop, what to add on. Yes, don't just stop the medications. And yes, we've really referred them, advised them to have a better health seeking behavior. Yeah.
Thank you, Miss Tisache, for the interview, for accepting to be part of the health camp. I believe you're going to be our ambassador when you go back to SAS Clinic. Send our warm regards to SAS Clinic and tell them thank you. We appreciate whatever support they've given us. And also for allowing you to come, because we know you're very busy people, you have heavy schedules, but sparing a whole day to be here with us, we just give glory to God, and may God continue to bless you, establish the work of your hands, and may you continue to do wonders with the community you're serving. And wherever He places you, please know you're there for a reason. Thank you, Ms. Chisache. I've been honored, and warm regards from Abundant Life Faith Center, from the Women of Faith.
Thank you so much. It's been an honor serving with you. The Lord bless you.
Our dear viewers, today, the 4th of October 2025, we've held our 4th annual Hope Health Camp. We thank you so much for the time you have listened to us. But from the health camp, we know the community has benefited, especially the elderly. We thank you for your support in all the ways you have done it, your time, your finances, your knowledge, and your help, which you have done directly and indirectly. We also thank our pastors, Mr. Enyimu and Mr. Mutesasira, who have given us this honor to allow us to hold the Hope Health Camp at Abundant Life Health Center. We give all the glory and honor to the Lord for using us to bless His people. Thank you so much, and God bless you.